Namaste everyone and welcome to my channel. I am Dr. Ferry Saleja, the clinical embryologist. A very interesting topic for you all to understand. Usually the patients who come down to a fertility center or a fertility counseling or a fertility treatment, they do not know the key roles of the doctors that are here to help you down. So let me just synchronize and help you down to know what is the trio that works in a fertility center. The trio includes a gynecologist, an andrologist, and an embryologist. That's me. So let's sum it up that how these three together perform as a team to build families in a fertility center. Let's talk about the detailed roles of a gynecologist, andrologist, and the embryologist in a fertility center. What does this trio do? A gynecologist is a medical doctor or an IVF specialist who specializes in women's health particularly. Let me repeat this. Women's health. Particularly the reproductive health in a fertility center. Their role is very, very crucial in helping women overcome their reproductive challenges. Alright? So responsibilities of a gynecologist are the initial consultations evaluating women's reproductive health and identifying the potential fertility issues and factors which are involved. The fertility treatments, administrating fertility medication, the clinical possibilities, performing IUI, that is nothing but intrauterine insemination, and managing IVF, that is in vitro fertilization cycles. Many surgical procedures like laparoscopy, hysteroscopy, egg retrieval or the pickup, prenatal care, monitoring pregnancies and providing care to the expectant mothers as well. Reproductive endocrinology, diagnosing treatment, hormonal imbalances affecting fertility, menstrual disorders, managing conditions like PCOS, polycystic ovarian syndrome, endometriosis and fibroids in women, pregnancy complications, handling high-risk pregnancies and providing emergency care. This sums up what a gynecologist does in a fertility center. Let's talk about andrologist. Who is an andrologist? What does he do? An andrologist is a medical doctor who specializes in male reproductive health. Let me get you here. Male reproductive health. In a fertility center, they play a very vital and crucial role in diagnostic and treating a male infertility clinically and surgically. Semen analysis, evaluating sperm quality, and diagnosing how a sperm parameters can be improved, it's his first job. Male infertility treatment, diagnosing and treating conditions, how low sperm count, poor motility and hormonal imbalances can be regulated in a male. Surgical procedures, surgical sperm retrieval techniques, performing procedures like vasectomy reversal, sperm retrieval techniques, varicocele, erectile dysfunction, providing options for men undergoing the treatment may impact the fertility by counseling them for fertility preservation. Male reproductive endocrinology, diagnosing and treating hormonal imbalances in male, sexual dysfunction, erectile dysfunction, treating conditions, premature ejaculations and low libido in men. Genetic conditions, of course, providing guidance on genetic factors of male infertility. And here comes last but not the least and very vital and important person who works in a fertility center, the embryologist. So what does an embryologist do in a fertility center? Embryologists are doctors, scientists, researchers, whoever you call it, specialized in the study of manipulation of gametes and embryos in a laboratory setting. In a fertility center, they play a very vital role. Right from skillful IVF and ICSI procedures, fertilizing the eggs, monitoring embryos, embryo culture, their development, performing embryo transfer, assessing the quality of the embryos, the gametes for a sustainable pregnancy. The cryopreservations, freezing, storing the embryos for future, genetic testing, conducting tests to detect the chromosomal abnormalities in the embryos present or not, mastering all the techniques which are done in a laboratory setting. All this stuff is done by an embryologist. An embryologist also takes care of the IVF lab completely, right from the Q and QC of the complete lab, the monitoring of all the instrumentation and the calibration of those instruments and the laboratory. By the way, the embryologists are also called as the first babysitter of the baby. So the collaboration and comprehensive care by this team in a fertility center of gynecologist, andrologist and embryologist, they work together to provide a very comprehensive care to patients and couples who come for the treatment. Their collaboration ensures that all aspects of reproductive health are addressed in the increasing chances of a successful fertility treatment and a healthy pregnancy. By understanding the distinct roles of these specialists in a fertility center, the individuals can better navigate the complex world of reproductive health and fertility treatment. This is how we run a fertility center. It's a teamwork. Namaste. Dr. Ferry Saleja signing off. Androplus.